Welcome to the Benefits Executive Roundtable, hosted by Dorothy Koshu, President of Advanced Benefit Consulting. Dorothy is a nationally recognized benefits and compliance consultant and group health broker. Here, you will watch and listen to industry experts who will break down the latest trends in employee benefits, healthcare reform, state and federal legislative and regulatory activities, all designed to empower executive decisions. We are proud to bring to you all new for Season 6 video podcasts. We hope that you enjoy your new video podcast format, and please forgive any audio or video imperfections. Thank you for viewing and listening.
Hello everyone, my name is Dorothy Koshu, and I'm a past NABIP Region 8 Vice President, a past President in the state of California, and a past President for my local chapter in Orange County, California. I currently serve as the VP of Communications and Public Affairs for CAHIP Orange County. I recently recorded a podcast with NABIP officials on legislative priorities and the recent experiences and messages that were shared with congressional representatives at NABIP's CAP Conference 2025 in Washington, D.C. That was done for the benefit of my own company's podcast, the Benefits Executive Roundtable. As a courtesy to NABIP, I'm providing a separate version of this podcast, which includes some valuable information for chapters and states throughout the country near the end of this podcast. The Benefits Executive Roundtable version does not include this chapter information, but that is available on all major podcast platforms and available on video on Spotify. You can find that at the Benefits Executive Roundtable, Season 6, Episode 16. We hope that you enjoy this NABIP version of this podcast. It's yet another example of brokers making a difference. Thanks, everyone. Welcome to the Benefits Executive Roundtable. I'm your host, Dorothy Koshu, President of Advanced Benefit Consulting, and I want to welcome you to our last episode of Season 6. I can't believe we're finishing 6 seasons of this podcast. I want to welcome my guests today. First, we have Alicia Riedel, who is the President of the National Association of Benefits and Insurance Professionals, or NABIP, as we call us ourselves, as well as Susan Ryder, who is the President-elect of NABIP, and we have Michael Andel, who's the Vice President of Congressional Affairs for NABIP. Thanks, all three of you, for being here today. I really appreciate it.
Welcome. Thank you for having us.
Well, for the benefit of our audience, they're not as familiar with NABIP as we all are. So can you tell our audience who NABIP is, what you're all about, what your mission is?
Dorothy, NABIP is the leading trade organization for brokers, agents, and other benefit professionals. And we represent over 100,000 agents, brokers, consultants. You can think about benefit specialists, PBMs, all different types of vendors that touch employee benefits. Our mission is really to influence, innovate, and educate and advance health and financial security for all Americans. We advocate for market-driven, consumer-centered solutions, and we collaborate with many different policymakers, coalitions, and different entities to really help make sure that we're improving healthcare access and affordability.
Talking about kind of our broader vision and mine as president and Susan, one thing I'd love to say for everybody is that Susan and I are a tag team, and it's our superpower. So thank you, Susan, for being my partner this year. You know, I'm really focused on, as is Susan, connecting, innovating, and leading in our space. And we really want to make sure that we're indispensable, that we are essential to our industry and to our clients, and help articulate that out. And obviously, we're more than just advocacy, which is where we're going to be spending a lot of our time today as a follow-up to Capitol Conference. But we also focus on professional development, AI-powered tools, relevant resources, obviously networking opportunities. You just got done telling me that you've been to CapCon, you've been a member of organization. I'm sure you feel it. Coming together, networking is a really important aspect of what we do. And also with our new CEO, Jessica Brooks Woods, and all of our staff and volunteer leaders, we are committed to leading the transformation of healthcare engagement and the healthcare industry. And we see ourselves as the bridge between consumers, employers, the healthcare system. And we really think that we're the umbrella that sees the entire ecosystem From the moment you're trying to choose a health plan that fits for you, if you're a Medicare beneficiary sitting at a table with your broker, all the way to a claim not being paid and your husband ill, and trying to help you navigate that system. In addition to what Susan said, which is bringing it all together with the vendors, the partners in the industry, we haven't done a great job of communicating that. And I think that's really a focus for us, and particularly for Jessica.
Well, thank you very much for that. And as you mentioned, and just for the benefit of our audience, full disclosure, as I always do, I've been a member for over 36 years, so I'm very much familiar with NABIP. They had a name change recently, by the way. It used to be the National Association of Health Underwriters, NAHU, and it recently changed to the current name of NABIP. So new acronyms for everyone. And Mike, would you like to comment on that at all? Why the name change?
I think they captured it accurately. Everything's changed and evolved so quickly, going back to Medicare Part D, Hillary Care, the Affordable Care Act. There's always changes, but the advent of the Affordable Care Act really did transformation for this industry. And so I think the name reflects that, not to mention all the other work that our agents do in Medicare Advantage and group health plans, you name it. So if you have health care, or if you have benefits, there's an agent involved. And a lot of times people don't see that. And I think that's one of our challenges, to show people the work that we do throughout the year.
Michael, do you think having the new name, instead of us being called underwriters, when we walk to the Hill and say we're benefits and insurance professionals, that really does help people see who we are quickly versus maybe historically?
I think so. Other associations that were the life underwriters also changed their names. I think people hear under something and they think undertakers. I'm not sure that Capitol Hill staff know the difference about that, but I think they know what a benefits advisor is. They know what an agent is.
Right.
Briefly, but we need to give them a better detail. They probably just think it's a one sale and you're done. They don't see the day-to-day activity where we provide services for our clients and stand in the breach when people are confused about what happened to their health plan, what happened to their prescription drug plan. Why is my small business paying too much for claims? They don't see that's the benefit that we provide, and that's what we're working to do. We don't have a Jake for State Farm for our industry, and we're going to fill that gap. And I think Dorothy's going to do a great job of starting today.
Well, I'll try very hard. I promise you. Well, as we mentioned, we just had something called CAP Conference. And just for the benefit of our audience, several hundred members like myself kind of embarked upon Washington, D.C. in February. And basically, by the way, before we get into that too much, I do want to congratulate you guys, the Board of Trustees, the staff, the volunteers, everybody, because I know how much work goes into these conferences, because I've been on the Board of Trustees there before, and I was president in California, president of my local chapter in Orange County. I've done a lot of these shows and so forth. They are not easy to put together. These things are months and months and months and months in the making, and I just want to say congratulations. It was a great CAP conference, and I just want to say thank you to everybody that was involved with that, because as an attendee for that, it was very beneficial, and I think it was very worthwhile. So having said that, we all embarked on, the steps of Washington, D.C., and we all got together. And what I'd like you to do is, first of all, tell me, why do you think it's so important to have everybody coming in from all over the country for that event?
I think when you fly in with any organization, because I do this for a couple different organizations, but when you come to the Hill in volume, that really speaks to the legislature. It shows them, that you really want to make a pretty significant impact, and you're really there to talk about a message, tell stories of their constituents. And when you have folks from every single state, like we did, we had over 700 participants this year. And even better than that, we had 250 first timers, which was fantastic. So exciting.
That's amazing. Well, while we were there, NABIP asked us to discuss a few issues. And one of the issues we talked about was from the very popular bipartisan healthcare package from the 118th Congress. And for those of you that aren't aware, we are now in Trump 2. We are in the 119th Congress. So I just want to make sure everyone is aware of that. And from what I understand, that package, basically, they just ran out of time, did they not? And getting that through, that's pretty much what I've been hearing.
Well, there was an end-of-year health package that have been negotiated all the way through. I mean, it's rare to have something that is not only bipartisan, but everybody's had a chance to poke it. And it was all set to go. And then there was a tweet, so to speak, that deep six that made a lot of people upset. But I understand there's efforts soon to revive that package. And NABIP agents have that on their list. Part of that package is popular reforms of pharmacy benefit managers. A lot of people don't know what goes into the black box of how those decisions are made. How are these pharmacy benefits applied? Where the savings come from? Site neutral payments where hospitals buy up different medical practices and then slap on a hospital name and bill hospital rates for something that the previous year was billed at an outpatient rate for a physician's office. Also dealing with extension of telehealth, whether it be in Medicare space or with high deductible health plans so people can have telehealth visits before they reach their deductible. All these things are very bipartisan and popular, and we're ready to get through. So that when we went to the Hill, everybody totally agreed. But that's the Washington way. You could totally agree, have everybody in the room, and something just kind of tips the scales in the wrong way. So I think we help move the needle, and hopefully we'll see some results here in a few weeks.
Yeah, let's hope so. Well, let's talk a little bit more about the telehealth issue. Can you tell our audience a little bit about what it is that we were discussing with legislators on telehealth?
During the pandemic, we saw an extension and expansion of telehealth rules. Telehealth had been around for a while, but the usage and uptake had not been as strong. Obviously, when you're sitting at home or doctor's office is not open for regular patients, telehealth was a great option for a lot of people. And a lot of employers picked that up too. And one area that we found a lot of people utilize telehealth is in mental health services, because we have networks of inadequacies. We don't have enough providers. We don't have enough providers in certain areas in mental health. And this is one way that could bridge locations so people can have access to a provider. Not to mention, if you just got a sniffle, you don't want to spend 3 hours waiting in a minute clinic just to go in there and say, hey, I've got a cold, and then you've missed half a day of work. So I think a lot of employers and employees saw the benefit of that. A lot of people on Capitol Hill understand the benefit of that. There's some cost associated with it, but I think the benefits also outweigh anything else, because if you can get care seen quickly, then you're not going to come back later to the emergency room or with, an untreated diagnosis because you were just skipped going to the doctor and you went ahead and go to work. So you think about how many people that used to come to work and spread germs. Hopefully you can get your telehealth, get your medicine, stay home for a day, come back and get healthy. So, and not spread it to the rest of your colleagues. So I think everybody agrees telehealth should be here to stay.
One of the things that I talked about with our legislators when we were talking to them was that I do a lot of self-insured health plans. I work with a lot of groups that are self-insured, and we actually see the costs of benefits. And I was explaining to them that the average cost of a telehealth visit is like $55 versus the cost of, at least in California, and the cost of a doctor's visit, brick and mortar, is, anywhere from $130 to a couple of $100, $250. And then I went on and on, urgent care goes up from there and emergency room goes up from there. And I kind of walked them through, and they were kind of surprised at the difference in price and how low telehealth costs really are. And I think pointing that out was something that a lot of people weren't aware of.
I want to build on what you just said, right? So my clients are self-funded employers, often Fortune 50, Fortune 100 clients, right? So when they're thinking about their benefits, one, it's years in advance. And philosophically, for many years, these self-funded employers, not just because of the cost, that's a really important piece of it, but to what Michael was saying, the productivity, the engagement with your employees, your ability for you to run your business effectively and have your employees show up healthy, not spread germs, all of the other implications that having first dollar coverage and not jeopardizing HSA eligibility is really where I see my clients saying, this isn't fair, right? Like, why are we penalizing people for doing the right thing? And that's the question that I keep getting asked, and why I think it's important we advocate for this to change.
I have a lot of clients in rural counties, and it can be really difficult. They may not even have a minute clinic option. And so they have to drive quite a distance, or even folks who are older who might have comorbidities or low immune systems. And so telehealth really is a benefit for everyone. Everyone wins, right? That's what we're really looking for when agents and brokers are trying to help their clients, whether an employer or an individual.
Right. And from what I understand, that 118th Congress package, it was basically about codifying the telehealth, right, for the high deductible health plans. So there are some Medicare implications for this as well, correct?
That is correct.
Okay.
Absolutely.
Okay. Well, the next thing I want to talk about within that same package, as you mentioned, Mike, the PBM reforms, the pharmacy benefit manager reforms. Can you tell us about that? And this was pretty much a lot about transparency and the CAA and so forth, correct?
That's right. Well, you got a couple of things happening all at once. There's been a big push in Congress. It's been very bipartisan to really ask the question about pharmacy benefit managers. I mean, that business model in and of itself is not bad. There's a lot of quote unquote good PBMs which have a place in the world. And it's not necessarily the eye of the beholder, it's the experience of the employers and the people that engage with them. You have a lot of independent pharmacists that are being squeezed by the system. You have a lot of employers that don't know what they're paying for certain drugs. And it's come to a head. And I think without beating up so much on the health plans, because that's kind of easy, there's a lot of vertical integration in the system where you have some of the large plans own the PBMs and own the pharmacy chains and sometimes own the practices. And instead of providing cost savings all the way through, like a Walmart style, you almost find like cut and add pad profits all the way through that system. So that's what's really infuriated Congress. And some of our speakers at the Capitol Conference were actually on a panel last week just to talk about PBM reform. I'm kind of watching to see how it plays out, to see the details. But I think the first focus is going to be focused on Medicare, because that's where the real savings to the federal government will be in that program. But anything that happens in the Medicare space, it's so large, it will have benefits in the commercial market space. Sure, Susan and Alicia can provide more real-world examples about this.
Yeah, I think about, as a broker working with clients, really explaining to them sort of the terms of the PBM contract, especially if they're self-funded or maybe they participate in a captive arrangement or something like that, where you're really, the details matter, right? Whether or not you have rebates, or are you performing audits to make sure that the pharmacy claims are being paid as the contract states, keeping a pulse on the formulary list to make sure that you have enough access to different medications and different therapeutic classes. There's so many moving parts that, the role of the broker really becomes critical in that perspective. I guess some people call themselves a consultant versus a broker. They're really one and the same. It's just their methodology about how they consult with their clients that differs. And I think, it's just really important for people to understand, especially consumers, that there are a lot of things that your employer does on your behalf to make sure that you have appropriate access and that you're set up financially to be able to get the medications that you need for your particular disease state.
I want to add to that, too, because you mentioned a couple of things. First of all, Mike, you mentioned some of the speakers that you had on one of the panels, and I think that was one of the most interesting sessions I listened to, by the way, because I'm involved with this because we do self-funding, and I do all of the CAG clause reporting, all the attestations for our clients, and my business partner does all the prescription drug reporting, right, the RxDC reporting. So he's got the June project, which is a lot bigger than the gag clause reporting in December. But the bottom line on that, and why this is one of the reasons this is so important, is because you mentioned those contracts. And the user, the employer, they may not know what those what gag clauses are in what contracts, because their PBMs have a lot of downstream contracts, right? They have their administrative agreement, and then they have an agreement from the administrator to the PBM, and then who knows how many other agreements they have going on. And I don't want to make this issue more complex, but just so that you know, those are some of the transparency issues that the panelists were talking about, because you don't have control over that. What's happening is you don't have access to what we're supposed to have access to a lot of times. And Alicia, you mentioned you deal with self-funded employers too, so you've probably seen a lot of this as well. They need to be able to have that information in order to do what the government, under the CAA rules, they basically force us to do this. They said you are required to make these filings, and yet if we don't have the information available to us, we can't. So some of those reforms were having to do with that transparency side of that, but that's always been my take on this. It has to do a lot with those things, because we are required to do those gag clause reporting attestations in December, and we are required to have those our RxDC reporting, submitted in June of each year.
Yeah, I mean, first of all, you're speaking my language, so I love it. But second of all, I think I hate to use this word because it has some other meanings to it, but it feels very unfair that, those large self-funded employers might be able to contract with a pharmacy consultant who knows how to read each of those contracts and pull out the pieces that potentially have risk around them or aren't transparent and be able to translate that. I'm fortunate to be able to help my clients navigate through those contracts. So for example, often we'll build in audits right into their contract, right? And often find much savings. I'm talking millions of dollars in savings or rebates that are coming back that weren't identified the first time around. And so, yes, I provide value. My company provides value to our client in being able to do that. We're certainly not catching everything. The vertical integration piece and the piece you're talking about with all of these different pieces that are contractually associated with that relationship, I don't know how you'd ever get to the bottom of every single one of them with the lack of transparency. But I think the point is, it should be much more clear for everybody what we're paying for and who's getting paid to do it. And you shouldn't have to put this many controls in place to try to at least get close to what's actually happening.
Right. But my bottom line on it is, hey, if you're asking us, the regulators are saying we have to file, attestations on this, then you've got to give us the tools to be able to honestly answer those questions on the attestation forms. And without the transparency, you just can't do that. It's just not possible. So I was really glad that, by the way, that panel was there at the conference, because it was very helpful. Well, the third part of that particular part of the 118th Congress package that we were talking about was the site neutral payments. And Mike, you mentioned that. Can you tell us why that's so important? What does site neutral mean?
I think a great example, sorry, Mike, I just stepped on your toes. I think a great example is you as a patient go to your local hospital in a rural area, right? And it's one building, one side is urgent care, one side is the emergency room. You as the patient have no control over which side you go to. You check in at the desk, and based on when they have a bed available and a provider available, they put you somewhere. Well, many times you end up on the emergency room side for something that could have very well been done on the urgent care side. And so not only do you have a higher cost for the health plan itself, but the consumer now has their deductible and their coinsurance apply rather than just a flat copay in many cases. Of course, all plans have different strategies and different plan designs, but many times in the emergency room, you have a lot more out-of-pocket expense as a consumer.
And especially in the Medicare space, again, over and over and over, you bill the hospital rate, and that adds to the government's cost. So that's between that and the PBM reforms. Those are two cost savings, and Congress is looking for savings right now, but it also aligns with consumer protection, and it will have secondary benefits in the commercial space. But we're going to start pushing to make sure that this happens across the board, at least. And a lot of people still have problems with surprise billing and other places where they don't, even as a consumer, you have no idea how to know where to pick your place of service. You have no idea what doctor's practice you should go through. It's still a mess, and that's where a lot of people should go back and talk to their agent or broker and say, what's going on here? Can you help me?
Yeah, and I think the one really important factor on that is fact that a lot of big hospital conglomerates are buying up these small medical providers, right? And when doing that, what they used to consider a doctor's office visit, $150 doctor's office visit, they're putting a facility charge on that bill, right? Because they're now owned by a hospital. And that facility charge can be thousands of dollars at times. It could be, if somebody thinks they're going to pay a $10 or $20 or $30 copay or something, it may not be as important to them, but to people actually paying the claims, like self-insured employers and so forth. But health costs overall, because health insurance goes up because healthcare costs go up, right? I think that's important for people to know. But it's important that people understand that when those hospitals buy up those doctors' offices, they're loading those bills with, in a lot of cases, with facility charges, and that is one of the things that's driving the costs up. And I think that's something that the industry, we're very concerned about, because, we don't like to deliver to our clients that they're getting another 15% increase, another 12% increase, another 21% increase, which is why I like self-insurance so much, by the way. But I think that's a big part of that whole site neutral thing, is that people need to understand that this is happening in the world of healthcare. And our jobs as brokers and consultants is not really we can't control the market, but what we can do is control, how we educate people within the market, right? So things like what we're doing at CAP conference, trying to educate the legislators and their staffs on these types of things. And by doing this sort of podcast and others, hopefully people will understand that there's a lot to the fact that your prices are going up on your health premiums. And NABIP is one of the organizations that's always involved with that, trying to make sure that that doesn't happen, and educate people, in Congress and so forth, as to what's happening in the real world and what we can do to kind of bring those costs down. And I think that's one role that people don't really think about when they think about an organization like NABIP, but you're very much involved in that. And I just wanted to bring that up because I think our audience needs to hear that. So my 2 cents on that.
I just want to bring it back home, right, to what Susan said at the beginning. And interestingly, after CapCon, I went on to that social media platform called TikTok that I'm too old to actually understand, and just did some searching for people that were dealing with medical bills, right? So I've seen, a new parents who are like my daughter's age, who brought their bill on a TikTok, and they're like, we were charged for this and it's called the facility fee. And then we were charged for this and it was called the baby, baby room stay, but they were in the same room with us and they walked through it. And with the knowledge that I have, I'm sitting there going, well, yeah, has a lot to do with site neutral, because they came in through the ER and they're getting charged for facility fees. And what we're trying to do at NABIP, in addition to the really important part that you just described, which is help legislators understand it and for us to translate for a client, it's help the average person be represented in this conversation and bringing forward the experiences that Susan has or I have when we talk to our neighbors or the Medicare beneficiary or whomever about why their bill was so high, and they couldn't do anything. Well, I didn't know. I went to the urgent care. Why is this way? And that's the piece, I think, what Michael was getting to earlier, that we haven't been great about communicating. This isn't just a financial thing. It's not just, and that's important, but it's how people experience the healthcare system. And it's crazy that it can tie back to something very specific like this, that if we changed it, it would probably change experiences for patients.
Yeah, absolutely.
Yeah, I think, Alicia, that ties really well into the NABIP, Consumer Bill of Rights, right? Where one of the aspects of that is to make sure that people have access not only to quality care, but also to affordable care. And so we really need to make sure Congress understands on the Hill, through stories from the people that we serve, how these types of payments are really impacting their constituents.
Yeah, absolutely. Well, let's move on to another topic, because I think we have a lot of things that I want to cover with you guys today. Let's talk about the second issue that we talked about on the Hill with legislators during Capitol Conference, and that's protecting the preferred tax treatment for healthcare. Let's start with the ACA marketplace premium tax credits. Do you want to comment on that?
Well, I can start and just say my opinion, which I think a lot of people in NABIP have, and then Michael can get into the actual legislative actions or things we think are important around this. But if we eliminate tax credits, it will disrupt the market as it is today. And is that really what we're trying to do, right? Like, that's the ultimate question for me, is if you start messing with the employer tax credits or the premium tax credits that people are getting, it's like starting from scratch a little bit. And so the implication of some of these things is really huge. And I think a lot of people don't understand it, because what we hear is it's going to save money because more money goes back to the federal government. But we don't really understand what that's going to do to the market.
The enhanced premium tax credits were created during the pandemic to provide more affordable coverage up into the middle income for a lot of people, or lower middle income above Medicaid. And it's been successful, and it was extended, but it expires in 2025 at the end of the year. And what we find are that a lot of the clients that are served are 1099s, small business people, or people who are just before Medicare age, and people who are in between jobs. It's better than COBRA in some circumstances for a lot of people. And we have some agents that are encouraging some of these federal employees that are now without jobs to consider, looking at their ACA practice and come sit with an agent, see what we can do for you. This is a mature market now. We have over 24 million people in this last enrollment, and the growth in the last couple of years have been in red states. California and New York already were early adopters. They've kind of plateaued in the growth in their ACA markets, and a lot of the growth is in states that Democrats aren't very strong in. So it's been adopted across the country and quite popular, and a lot of people coming in and out. So what's going to happen if this goes away is you're going to have people that have affordable coverage for themselves and their family, and you're going to see an explosion in their monthly premiums. And that's going to be very upsetting to a lot of people. So what does that do? They're going to either go without insurance or look for those cut rate plans that are bad, and it's not the ideal situation. You also have pressures on employers from a lot of regulations. We're going to talk about the IRA and other issues that are causing mental health parity. A lot of pressures on smaller employers, a lot of pressures on the Medicaid space. So we need to think about this whole system together. And the ACA tax credits can be reformed. We have agents that are working with groups on Capitol Hill and some of the committees to refine how they're applied, to make sure that people, when they estimate their income, they're estimating it correctly. We don't want anybody to have penalty. We want to be sure that nobody's abusing the system, of course. But most people, just day to day, they want to be sure that they have insurance. They sat down with an agent, they went over their options, and they're good to go. They don't want to hear about it anymore.
Yeah,
when they wake up the next...
It's been 15 years. The ACA came about in 2010. This is March of 2025. This month is the 15-year anniversary of the ACA. So it's something that everyone has gotten used to. It's not like we've had it for a year. We've had it around for 15 years. It's been around. And you're right. I mean, people have gotten used to that, and people have planned around that, and their budgets and everything else. I mean, without that, that would definitely harm a lot of people for sure.
Only a couple of years ago, the ACA market was enrolling like 8 million people, 6 million people. To be in 24 million, I mean, that's a robust market, and consumers vote with their feet, right? They go where they want to purchase whatever product it is. So this has been adopted by a broad segment of society. Like I said, a lot of people go between jobs. Maybe they want to be a contractor or a 1099, and this is something that helps them do that. It gives flexibility. So we've been working on our messaging and talking to members of Congress about that. And a lot of people are receptive to that message.
And one thing that we haven't talked about is if someone can no longer afford their health insurance plan because they're unemployed for whatever circumstance, then they go without treatment for care. And then when they do come back into the insurance market, whether through an employer or individual or Medicare, their claims tend to be much more significant because they waited too long for care. And we don't want people putting off preventive care that helps identify things really early. And I think that's one of the great things that happened out of the ACA, right? It's that everyone has preventive care covered at 100%, regardless of the plan that you're on. It's great.
Right. Well, at least unless they're grandfathered, but I do still have, believe it or not, I still have some grandfathered self-funded health plans. But yeah, absolutely. Well, let's move on to the second part of that. We mentioned, obviously, we talked a lot about the ACA marketplace, but let's talk about preserving the tax incentives for employer-sponsored health plans. That's a huge population of individuals that are covered by group health plans in this country. And I'm hearing numbers everywhere from 153 million to 178 million. I heard another organization say something about 192 million. So it's a lot of people. Right. And I think depending on who you're talking to, the numbers might, but it's a lot of people that are covered by this. So what can you guys tell everyone about how important it is, besides my preaching about it, to preserve the tax incentives for the employers to offer these plans to their employees and their plan participants, their dependents?
I'll give you my perspective. Again, I work exclusively with employers, and talk about disrupting our healthcare ecosystem. You take away those tax credits, and every single employer is going to be reevaluating whether or not offering medical coverage and health plan coverage to their employees makes sense anymore. And we went through a bunch of analyses years and years ago, when you look at the Cadillac tax and other mechanisms that were in place to see, should I offer coverage? Should I not offer coverage? And if those triggers got employers thinking about whether or not they're going to offer coverage or not, imagine what happens when the tax credits go away for the employer. Our system is built on employer-sponsored coverage. And even though bringing those dollars back into the federal government would help our country in many ways, the ramifications are, I can't even imagine how many ramifications there are. I could talk all day about it. So I think the first thing for me is just people really understanding what that means. So if we talk about ACA premium tax credits go ahead.
I was going to say, employers seem to really enjoy giving health benefits to their employees. It's a recruiting tool. It's a retention tool. And they want to do something to make sure they're helping take care of their employees and their dependents, right? And that's the whole basis on which our system is based on. And it's been very, very successful. And my personal thoughts on this are, if it's not broke, don't fix it. It's not, that part of the system is not broken at all. People enjoy employer-sponsored healthcare coverage, and employees enjoy having coverage provided by their employers. And you're right, employers are not going to pay for it. They're not going to do it if they don't have a tax incentive to do so. I mean, it's just way too expensive to do that.
I mean, the big other thing that would be impacted is innovation, right? Like, employers are the ones, the large employers in particular, that are leading the way with innovation around healthcare design, right? So, for example, Wells Fargo has included health which is a combination of health advocacy and second opinion services built into their program, and having care management programs that might be much more robust or personalized. All of those innovations are really, and they go to the whole market at some point, but when employers are thinking about, how do I make my employees happier, healthier, more productive, they'll actually use the benefits that are provided, all the things that come from offering and having good health insurance and other benefits. That innovation and what's happening in that market, what happens to that if employers stop providing employer-sponsored health care coverage?
Susan, you look like you had something to say earlier, or did we cover it all for you?
No, I was going to share something similar to what Alicia just did, but, I think so many employees also, we have the benefit of pre-tax contributions when our employer is offering a plan. If we go out to the individual market and we don't, maybe our income is too high, we might not get a tax incentive through there. So there's lots of different benefits.
Yeah,
for
absolutely.
everyone.
Absolutely. Yeah. Well, the last part of that was basically extending the small business healthcare business deduction. That's not the same thing as the standard business deduction, correct? Let's kind of educate people on this a little bit.
It shouldn't be described as healthcare. It's really is the small business 20% deduction. But yeah, this is essentially in the tax cuts that happened in Trump 1.0, provided that 20% deduction for smaller businesses. And the reason it applies to our members are a lot of our members, we have a lot of people in the group space, but we have a lot of people that have their own agency, or they're just a small kind of Main Street shop, and this would impact their business. So this is more about our own members who are small business owners and ensuring that tax deduction stays in. And we're partnering with NFIB, Federation of Independent Businesses, on that.
Well, let's talk about the next issue, which there's several parts to this, but the Medicare issues. NABIP is asking that Congress defend access to the critical guidance and coverage for seniors. Can you talk to us about this and tell us what this means? I know there's several parts to this. Can you kind of walk us through all these Medicare issues?
I mean, just to put it in context, right? So when a Medicare beneficiary receives help from a broker or agent, it's critical. I imagine my neighbor who's 93 sitting at the table with my brother who's now a Medicare agent, and then pulling out their bucket of medications and bringing them to the table and saying, help me figure out what plan I should choose based on these medications I'm taking. And then my husband goes to the VA, but I can't, so I go here. And being able to have someone go through that entire journey with you as a beneficiary, it is invaluable, right? And so that's first and foremost, I think what we're trying to do here is to elevate the conversation about whether brokers get paid or have access to selling certain plans. It's more about, do they have the resources and the tools and the ability to help their beneficiary client through the entire journey? And that's why we did this massive survey that I think we're nearing 15,000 respondents, and many of those are beneficiaries, trying to bring to light who brokers and agents are for their beneficiaries. And that, a call center and some of the bad practices that have happened out there, that doesn't represent who we are here at NABIP and the agents that we represent. And so when I think about my neighbor Jan and her having to call into a call center or enroll herself on the computer, I can't even imagine her being able to do that. And so having access to us is critical for our senior population. But Michael can get into more about kind of how we're helping and what we think there's levers we can pull on.
Yeah, this last annual enrollment AEP for Medicare was really traumatic for our members. You had an egregious CMS, Centers for Medicare and Medicaid Services, create so many, I don't know if it's well-intended policies last year, just very bureaucratic. So created a whole new regulatory regime. And that's been going on for the last couple of years. But then you had some other policies that happened last year that really squeezed the health plans. So what did the health plans do? They started doing things like eliminating commissions for agents in the middle of the enrollment. So you start the enrollment talking to your client base, and all of a sudden you're not going to be paid for it. And then the plans say, we're not going to pay you for any past enrollments for all the work that you did marketing and talking to people on behalf of our policies, whether it be Medicare Advantage or prescription drug plans. We're just not going to pay you, and thank you for doing that for free as a public service. Meanwhile, our shareholders are going to get stock buybacks. Our executives are going to get seven-figure benefit packages. I mean, good for them, but why should our members have to work for free? And what do our members do? Within a few weeks, that's as long as that enrollment process is, they have to sit down with seniors and other beneficiaries and walk them through their plans. Are there doctors in network? I don't know. Is there hospital in network? I don't know. Hospitals play games with the health plans too. We're going to drop this health plan and surprise everybody in certain states and throw everybody into chaos. And then 3 months later, we're going to come back. I mean, I hate to get on the soapbox about it, but it's really ridiculous. And who is at the end of this? And that's the beneficiaries, with the constituents for these members of Congress. Oh, there's 70 prescription drug plans in my area. Is my formulary correct? I don't know. Wait till you go to the pharmacist in January and find out. So the couple of bills that we've been working on, one is going to allow people to change their prescription drug plan if they find out that their network is not adequate. And a lot of times seniors think they're in the network. They've checked it. By the time they sign up in November and come to the pharmacy in January, it's wrong. Another thing we're going to work on, this is a bill we're going to reintroduce soon. If you're a senior and you work and something happens, you're leaving your job and you go on COBRA benefits. Maybe your spouse is not Medicare age, and maybe you are. There's different reasons why people would keep COBRA coverage. COBRA's not really attractive in and of itself, but there are reasons why people pick it in that scenario. When they sign up for Medicare, it's not considered credible coverage, and for the rest of their lives, they're penalized for no other reason. Then it's not considered credible coverage, even though it's the same plan you had at your employer. Seniors are marketed left and right by near criminal enterprises who telephone them multiple times a day, spam them on social media, even though they've signed up for coverage. My parents only have a med sup plan and a prescription drug plan. They sign up with their agent early on in AEP, and I've been at their house over the holidays and seen the junk mail, heard the calls. They screen their calls. So if you're a senior that doesn't have, a family helping you walk through this, or an agent, you're going to be confused. So we really need to get this marketing taken out so that your local agent who you sit and look at can help you. And what does it matter to the agent? The agent makes money, barely makes money on these plans, but they build a career based on referrals, based on community respect. So you're trying your best through all this stress from health plans not wanting to pay commissions, make you work for free, health plans wanting to have prior authorization so your clients can't even get a service they need, hospitals not wanting to take plans. It's very frustrating for everybody. And the thing about our agents not getting paid, if you're not getting paid, then you're not the agent of record. And what does that mean? You're not authorized to advocate on behalf of the beneficiary. So if they've got a plan mid-year, if they've signed up for a plan directly, who do they have to call? 1-800-MEDICARE, which we know they're firing everybody at CMS and HHS. And I don't care if it's a contractor, they might lose that contract. So how many hours are you going to sit on the phone with 1-800-MEDICARE, your friends? Or you're going to go to the health plan, which good luck calling them. I can't call my health plan. I go to an agent. She tries to help me. It's terrible. So
Michael,
it's a big
more
mess.
than just commission, right? It's like literally saying, I can enroll you in this part of your Medicare, but you senior need to go enroll yourself in this part of your Medicare. And then when you're confused in January and you call your agent, they say, I can't see anything. I can't go into the system and see that policy. I can't do the things that I would be able to do on this part of your Medicare, right? So that is even more critical, I think, than the commission part. Because I'll tell you, I've been hearing from our members, my brother, others. I just help them anyways because it's the right thing to do. But I feel really uncomfortable because I'm not their agent of record, and am I protected if I do something wrong? Like
that's
and
a
I thought
big
that
point,
might sing to you a little bit.
Yeah. A lot of times, isn't it true that a lot of times I don't do any Medicare. I'm a large group person, but I don't do any Medicare. But isn't it true that a lot of times the E&O coverage won't cover you if you're not getting compensated for that product? If you're not
That's my understanding, product. Right?
So
yeah.
So they basically, you're going out there and you're helping them. You're not getting paid a commission, so your errors and omissions coverage isn't going to cover you. So then agents are going to say, well, if I'm not going to be covered under E&O, I can't help you. And then what happens? The senior goes without assistance. And I think that's the worst market that you can possibly have no assistance in, because as Mike said and so forth, it's just, they really need it. They really need it. They don't understand. And like you said, they sign up for a plan because agents take the time. And again, I don't sell Medicare, so there's no personal incentive for me to talk about this, but the agents sit down and they take the time to make sure to check what drugs are you on? Who are your doctors? Who are your providers? And they check all that, spend hours upon hours doing this research for these clients, for these Medicare recipients, to get them in the right plans. And then as you said, then in January, they change the formulary. And that means that the drugs that they thought were on the plan are no longer covered under the plan, or they have a tremendously high cost where they could have gotten on another plan that does cover it, but they went by what was going on. So again, the legislation that NABIP is talking about is to allow people to make that change after they're enrolled because of the information they were giving during the open enrollment period. And now it's changed because the carrier decides to drop the formulary or change the formulary. And then they would have an option to come back and say, okay, well, I chose this plan because of this. And because of that, I want to change to a different plan. I think that's the point that we were trying to make. Is that correct?
Yeah.
Okay.
There's no better advocate for the senior than their local agent. The doctor absolutely wants to advocate for them, but the doctor gets, 15 minutes? If you're lucky, they're so busy with their practice and everything they else have to do in their practice. So who's going to have time to sit there and try to call the health plan to find out what happened to your hospital bill? And they want to expect you to do this for free? So I feel like there's a lot of problems in this system, but we're going to advocate throughout this year. We just released a letter with other agent associations this week. It's on our website discussing all these problems and how we're going to work on it. And you're going to hear a lot more from us about this. There's a huge conference coming up. Medicarians, NABIP will be there in force. And so stay tuned on these issues.
Yeah, and I just wanted to come back to that because you mentioned COBRA, the not being credible coverage. Can you guys just explain very simply? To me, it's ridiculous that COBRA has never been credible coverage. Can you just explain what it means by the fact that it's not credible coverage and why that's important?
So the easiest way to think of it is I'm on a health plan through my employer, and I turn this magic age of 65. And for my particular family situation, I decide that it would be more advantageous to stay on the group health plan. And so I elect COBRA for myself and my family members. But because I didn't pick up Part D and my plan isn't considered credible, that means I'm going to have a financial penalty for the duration that I'm on Medicare.
Mm-hmm. Yeah, it's not a
that never, ever goes away.
That to me makes absolutely no sense. I can't believe after all these years of talking to people on the Hill about this, why haven't they done something about this?
Well, and think about it, right? When you're retiring, like you're going on to a fixed income, you're no longer going to have the income potential that you had before. And now there's this extra financial penalty that you weren't anticipating when you did everything to the best of your knowledge, right. Good faith effort. And nothing happened to the plan design. Nothing changed. Right. Except that you turned 65.
Yeah. And I mean, just to bring it to life, like Susan said, because of your family circumstances, I want to talk about what that means. Your husband's going through cancer treatment and you have a $5,000 deductible and you're going to a specific provider and you've met your out of pocket for the year. Maybe it's June. You're on a fixed income now. And now you're saying, I want to ride this plan for the rest of the year. Because yes, I have to pay higher premiums to stay on COBRA because it's whatever the employer is, cost is, plus usually some sort of surcharge. But I've already met my deductible. I've already met my out-of-pocket and my doctor's in my network. And I'm not sure they're going to be in the network for my Medicare plan. I mean, that's what that means. It means that if somebody's trying to make that kind of choice and they say, for all the reasons I just said, I'm going to stay on my plan for a little while longer, now they have to pay a penalty for the rest of their lives.
Right. That makes no sense. Well, I'm glad that NABIP is continuing to push for that because that's something that there's no excuse for it not to happen. I mean, that's something that could be so easy to fix that I'm surprised that it hasn't been. Well, I know there are a lot of other issues. We've been talking about all the things that we talked about on the Hill when we were there and for the conference in February, but I know there are a lot of other issues that NABIP's been working on, and I think our audience would really like to hear about some of them. Can you tell us what are the other important legislative areas that you guys are working on right now?
Well, I'll just lead with kind of from a strategic point of view what we're doing, and Michael can fill in the blanks. But I think what is really important, what we try to stress, particularly to those that were at CapCon and for those that lead their regions and chapters to come back to their states with, is that advocacy is not a one and done kind of thing. That what we're doing on the Hill and federally needs to be reinforced at the state level. And each state is different, and NABIP has so many people and so much resources, and we focus most of that on federal issues. We support our states in helping them fight single payer or whatever those issues are. But they need to, members of our organization, people in our industry need to talk to the lawmakers while they're in district and continue the conversation. And they need to tell us about it. So there's a way to log your appointments. People have heard it ad nauseum from us that they need to log their visits so that we have a repository to tap into. When Michael's on the Hill and he's trying to have a conversation, he can quickly say, you met with 7 of our members and here's what you're hearing from us, or whatever. But you also need to log what you're doing in district and identify your relationships. So if we need to lean into one of your relationships, we are able to do so in a way that's effective. And then we also, because of the strategy around that, we developed a plan last August that we delivered to our chapters to say, here's some tools for you to, how do you set up those meetings in district? How do you conduct yourself? Some of the same kind of training we tried to do this year at CapCon as people went on the Hill. So give us feedback if you have any around how we can help you in district. Also, Operation Shout is a tool that can be used both at the federal level from us at NABIP, and then the states can use it as well. And so essentially it's our tool that says it's a rallying cry. There's an issue that's really important. We need you to talk to the legislators through this unified message. And it's a really easy tool to be able to use. And so you need to participate if you get the email. And you also need to think about in your chapters how you could use that tool if you need to. We also have ways for members to get a hold of us differently than before. So we have your Voice Matters app. So that way, if there's something going on, and yes, use your regional alignment on Ledge Council or your RVPs or your chapter leaders, but also you can talk to us directly through the Your Voice Matters, and we're really listening there. And then I think finally is that we have the Brokers Making a Difference campaign that it has been really bolstered by all of the survey results that we've received. And so we've created toolkits for each state to be able to bring that to their communities and to in district meetings to say, here's why we are essential, and here's what beneficiaries and agents are doing and how they experience their time with us. And so feedback about that is really important. So I think overall what I'm trying to say is that the more active you are as members and as chapters and as industry professionals, that is how much more powerful we become. We are only as powerful as the number of people that are behind us and with us.
Right.
And we really need to give that message out.
Yeah, I agree with that wholeheartedly. A lot of our audience members are employers. They're, C-suite executives, a lot of human resources departments, directors, human resources managers, and so forth. What would you say to them as far as dealing with an agent or broker consultant? What would you tell them about, the difference between maybe an agent being involved with an association like NABIP and one maybe that's not as involved with industry associations, and why that's important to an employer, to an HR department, to a CFO or a CEO?
So I think personally, my pitch when I'm in a meeting with a new client is I stress the professional development opportunities that I get access to. I stress my ability to leverage our attorneys on Compliance Corner, where I can get their questions answered in a matter of just, a limited amount of time with no expense to them, right? They have the ability when they work with a NABIP member to maybe have access to other folks across the country. I think back a few years ago, I had a client in California that needed something. Well, I contacted one of our members, Craig Gusson, and he was able to assist my client because I couldn't get there. So I think these are benefits of being a NABIP member that people might not see, but they're there, and we want to make sure that our brokers are prepared for what's to come in the future.
Because let's face it, legislation and regulations, all the regulatory side of this, that stuff's not easy. It's not easy to understand. And if they're not getting the information from an organization such as NABIP, where are they getting it from? Or are they getting it at all? And are they able to pass that on to their employer clients? Because those of you out there that are watching and listening that are those employers that are very loyal audience members of ours, and I want to thank you very much for that. It's important that you understand that a lot of you reached out to me and said things like, thank you for always talking about the most important things. I wouldn't have even known that this was a situation. I wouldn't have even known that this legislation was signed into law. I wouldn't even have known that this affects my employees and my company the way it is if it weren't for you. Well, the reason that people like me know about things like this is because of being part of an organization such as NABIP. I happen to be a compliance guru. I happen to be someone who's really into legislation and regulations. But I think overall, that because, as you mentioned, Susan, the education that they can get, the information they can get, and sharing from people across the country, getting all of the tools from not only lobbyists and so forth, but again, the professional development side of this, having that expertise level, having to know that you can go somewhere to find help if you don't have it, if you don't know how something works. I think that's important for employers to understand that you guys have, each industry has their own organizations that they belong to, right? Their own associations and so forth, their own networking. We happen to have NABIP as our primary federal organization that we rely on. But the whole point of it is, yes, it helps brokers and agents and consultants are members. But what we're doing is not just for the agent, the broker, the consultant. It's for the consumer. It's for the employer sponsoring a health plan. It's for the people that are actually using these benefits and have to comply with these complex, ridiculously complex laws and regulations, and having to file those RxDC reportings in June and the gag clause reporting in December, and having to do all the other stuff that they have to do for all the the myriad of laws and regulations and so forth. So thank you again, because it's really important that people understand that, yes, I asked Susan and Alicia and Mike to be on this podcast today to talk to all of us about what NABIP has been doing, because what they're doing is so important to all of us. It's not just us as agents and brokers and consultants, to all of our audience members that want to know more information. So hopefully this information has been helpful to you, and I really appreciate all of you guys being here today. What's next for NABIP? Is there anything that that's great. I love that graphic. That's really cool. I love the hearts.
I think we have a conference coming up in June in Miami. We are so excited. We're going to be at the Fontainebleau, and we are shaking things up. So just like Capitol Conference was a little bit different this year, so will convention. And we're bringing activities to the people. We're bringing vendors to the people. So I hope to see all agents and brokers. If you're not a member, that's okay. You can join, or you can come not being a member. You just have to pay a little bit more. But we are currently seeking speakers. So this is a great opportunity for our agents and brokers to highlight their expertise and share their knowledge with other folks across the country.
Yeah. And we also have audience members, by the way. We have some attorneys that are very loyal listeners and watchers on our video podcast. We have others that are really good. So again, it's another speaking opportunity for them if they want to take a look at that for the NABIP convention in June, which I believe is in Miami, correct?
It is.
Yeah, it's in Miami, and we're super excited. Like Susan said, I just have to emphasize, we have reimagined, and we're still in the process of reimagining how we engage with our members and others that want to be with us. And so if you felt the energy different at CapCon this year, you're going to feel it even more so, I think, at annual conference. It's going to be fun. But most importantly, the things you're going to learn there, the things you're going to take away are really meaningful. And a lot of the topics that we touched on the surface today, we're going to go deeper into what those things mean. And there should be a track for whatever industry, or whatever market you serve. We are super focused on enhancing the experience with us, from connecting, also innovating, but also leading. And again, I want to go back to the fact that we are way more powerful when we are able to stand together and push forward than if we don't. And so the more as a member you give to the association, the more we can give back. It's a two-way partnership that I feel like people are starting to really get on the bus with us. And it feels really nice.
Yeah. And when they do get more involved and they do have all this wonderful information to share with people like we're doing today, then they can help their clients. And that's the thing. Those of you that are employers, those of you that are, sitting back there and say, I need to learn all these things. Where do you get it? Most of the time you get it from your agents and brokers, and that's how we get it. We belong to organizations like this, and I do a lot of research on my own as well. Of course, I have to. Mm-hmm. But, this is where it starts, and this is where it comes from. So again, I want to thank you guys so much for being here today with me and taking so much of your very valuable time and sharing all these wonderful thoughts and helping our audience to understand what it is that we do on a daily basis to try to help everyone out there, the Medicare beneficiaries, the people that are on individual ACA plans, those groups that are on group health plans and so forth, to help them to understand what it is that we do for you on a daily basis, so that the information that you receive on your end and the compliance that you have to deal with, that we can help you with that so you can do all the things that you're required to do by law. So with that, I just wanted to say thank you very much, all of you guys, for being with me today. If anybody wants to reach out to NABIP, how would they do that?
You can visit nabip.org. It's NABIP.org.
Okay, great. Well, I hope that you guys will come back next year when we get together again, maybe update us some more on some of the legislative and regulatory actions that you guys are involved with. Until then, I want to say thank you very much for being my guests again today. And this is, as I mentioned before, our last episode of season 6. So for all of those individuals that listen to us and watch us on a regular basis, I just want to say once again, thank you for being loyal audience members. And we're going to be coming back in the fall. We usually come back in mid-September with season 7, and that will again be video podcasts. And by the way, if anything big comes up, legislation, regulatory, things like that, we do off-season podcasts from time to time, because I remember when COVID hit and things like that, it was right after the season was over. So we had to come and do all kinds of summer podcasts. So if that happens, we will continue to do that and give you special episodes in the meantime. But I just wanted to say thanks again, Susan, Alicia, and Mike, for being with me today. I really appreciate you guys.
Thank you so much.
Thank you.
Thanks, Dorothy.
Thank you very much. And for everybody else out there, please stay safe, stay healthy, and stay tuned for the next season of the Benefits Executive Roundtable. Thanks, everyone.
Thanks for watching. Stay tuned for compliance tips, cost containment ideas, new trends, and decision-making tools. This podcast is produced by Advanced Benefit Consulting, Anaheim, California. All views expressed are those of the host or interviewees and not necessarily the views of Advanced Benefit Consulting. Information contained herein should not be construed as legal advice. We always recommend that you consult with your legal counsel as situations do vary. Ms. Koshu can be reached at 714-693-9754 extension 3 or toll free at 866-658-3835. By email at dmkoshu@advancedbenefitconsulting.com or visit our website at advancedbenefitconsulting.com.